Hi, everybody. We have a very difficult question to answer today. Why doctors refuse to treat elderly parents or patients with dementia. Now, there's a lot of controversy, a lot of different thoughts, suggestions, ideas on this topic, but let's talk about a couple of things. So we're going to answer the question of, when is it too late to explain to an older adult that they have dementia? And how many older adults really want to know that they have dementia or Alzheimer's? Then what happens when an elderly parent needs treatment? Does the doctor give the treatment or not give the treatment? These are all questions that caregivers are asking. I'm Pamela D Wilson. My website is pameladwilson.com. On there, a lot of hope, help, and support for caregivers and aging adults. And there's going to be an upcoming podcast on this topic with a lot more information. So stay tuned. So let's talk about knowledge about dementia and understanding. So if you have an elderly parent who has had memory loss and they're forgetful and you're thinking, something's going on, but they don't have a diagnosis, why is it important to even take that step? It's important for a number of reasons. So let's think about your parents. Your parents may not want to go to the doctor. They may be in total denial about their memory loss. They may have known that their mother or father had the disease and they may just want to know. They may be in denial. This is their choice. Now, your parent can also get the diagnosis and then the next day forget that they were even at the doctor's office and that they got the diagnosis. So why is it important to even take this step? It's important to take the step for the family caregivers. And it's important for you to know so that you can learn how to care for your parent with dementia or Alzheimer's, learn the difference, and so that you can plan. Because memory loss is progressive. It doesn't get better. Health is going to get worse. It's not going to get better. And as that spousal caregiver or the children, you need time to plan and you need to make a plan. So that's why it's important. So if you have a parent who says, oh, I don't want to know if I have memory loss. I don't want to know about it. I don't want to go for testing. Say, you know what? I know that you don't want to know, but I'm the one who's going to care for you. I need to know so that I can make a plan. So let's talk about treatment and diagnosis. Now, everybody, patients, parents, brothers, sisters, grandparents, has a right to refuse to acknowledge a diagnosis or refuse to agree to any type of treatment. And that could be medications, or if someone has cancer, they may not want chemotherapy or radiation, all kinds of reasons. Some people prefer to be in denial. They don't want to accept the seriousness of a situation because it's unpleasant. They want to avoid discussing it. And this is all a personal choice and a preference. Now, I spoke to an adult child caregiver this week, and her parents are in this state. They're in this state where they both have serious diagnoses and they're wanting to be as optimistic as possible. They don't want to burden the daughter with talking about it. And so the daughter feels pretty hopeless and helpless because they don't want to have the discussion and they don't want to accept care and she can't help. So admittedly, all the daughter can do in this situation is to be supportive and to listen until her parents change their decision about their care or the situation or about wanting her to be involved. So let's talk about the reverse. Why do doctors refuse to treat elderly people, patients, parents with dementia? Reasons are a couple of reasons. So doctors may see that there's really going to be no possible improvement in the person's health or well-being. Or that if they provide the treatment, they're going to provide it, but the person's quality of life really is not going to get better. It's not going to change the course of the disease. It's not going to lengthen the person's life by providing any quality of life. Now, this is hard to accept if you are that caregiver. This can be a stressful time. You may not understand why the doctor is saying, oh, no, we don't want to go to a specialist for pulmonology or cardiology. There's no point in doing that. But until you start asking why, you probably aren't at a point where you can understand that doing this is not going to make a difference in your parents' care. So it can be super frustrating if you're a spousal caregiver watching your husband or wife decline and they're refusing treatment, like to simple things like physical therapy, walk, exercise. You may be a spouse who's thinking, oh my gosh, if they don't walk or exercise, they're going to become bedbound and I don't know how I'm going to take care of them. I don't know how I'm going to keep them at home. That's very hard because when a person becomes bedbound, you're doing feeding, you're doing bed baths, you're managing incontinence, you're watching out for bed sores. It's very stressful. And you're a 24/7 caregiver. So your health and well-being is suffering. Now, this is the time when most family members will consider a nursing home because the caregiver just can't provide all of this 24-hour care. So as a family member or the caregiver, you might feel really guilty about this. But here's the challenge. You can't control the progression of dementia or Alzheimer's or really any chronic disease, right? And you can't control the willingness of a person with dementia or any chronic disease to participate in their own care, to want to exercise or walk or eat better or take medications. And so when you think about it, rather than risking caregiver burnout or unintentional poor care, looking for another option like a care community or a nursing home or bringing caregivers in really may be the kindest thing that you can do, not only for yourself, but for the person who you're caring for. Now let's go back to doctors' refusals of treatment. So if you're that caregiver and you hear the doctor saying no, 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 and you don't understand why, then it really is time for you to have that discussion of why are you refusing care so that I understand? What truly is the condition of my loved one? What's the prognosis? Meaning, what does it look like 3 months or 6 months from now? Maybe this is the time to discuss hospice care, which is another very uncomfortable discussion. But if you've come to the point where there really is nothing else that you can do for a loved one but, provide daily care and make them comfortable, then it's time to have some of these hard discussions. So all of these, though, discussions with doctors and what to do for a parent who has a very serious illness, they're personal decisions and they're hard decisions. So just as your parent, because of a cognitive disorder or something else, has a right to be in denial about their diagnosis, to refuse treatment, to say that they don't want to do things, doctors also have the right to refuse treatment if they see that a situation is futile, which means really that it's hopeless and nothing else can be done. And this is really a point of acceptance for the caregiver and the family member and everyone else involved. Allowing a disease to take its course, which it eventually will for all of us. None of us are exempt from this. We may be healthy today, but could be different in 10 or 20 years, right? So allowing a disease to take its course and providing care to a loved one, whether that's daily care or hospice care, and allowing them to eventually pass away without unnecessarily prolonging their life with no quality of life, can really be the kindest and most compassionate thing that you can do. Even though it's heartbreaking and you're going to miss them and it's going to drastically change your life and everybody else's life, we have to think about what's best for the person and the situation, setting aside our emotions as the caregiver, which can be very, very difficult. So it's important to find help and support for this. I'm Pamela D Wilson. Thanks for being here for this very difficult topic. You can obviously consult your physician about a prognosis for your elderly parent, consult an elder care advisor like myself, talk to a counselor, talk to a hospice counselor. There's a lot of hope, help, and support out there for end-of-life transitions for people that have dementia and other chronic diseases. Thanks for being here with me for this video, for this very difficult discussion. Please press the share button. Share this video with other people that you know who are looking for hope, help, and support. And also send them to my website, PamelaDWilson.com. There's a lot of articles, my weekly podcasts, my blog, my library, online courses, a lot of hope, help, and support there for caregivers and aging adults, a lot of education to help you be a better caregiver and to make the best decisions possible. Thanks for being here. I'll see you again soon in another video.